the News Channel 5 network. This is OpenLine.
Thanks for joining us on Open Line this evening. I'm Andrea Klein-Thomas filling in for Ben Hall. Now, it's the appointment we're told to make twice a year, not every 2 years, twice a year. But are you keeping with that schedule? We're talking about seeing a dentist. Today, we're going to talk to a dentist. All of those questions that you may have about your oral health, anything that you have, you can talk to a dentist, call in without having any of the anxiety or worries about going into an office, because a lot of people kind of feel like that. Yeah. We are talking to Dr. Richard Horwat, who's with Bluegrass Endodontics. Thanks for joining us.
Thanks. Nice to be here.
Yeah, tell us about your practice and a little bit about yourself.
Well, I'm partners with a Dr. Christopher Sandland. We have two practices. We are in Mount Juliet. We are also in Hendersonville. I did general dentistry for about 9 years total, 6 of those years in Annapolis, Maryland. And then I decided to go back to school and specialize in endodontics. I was doing root canals every day anyway. So I thought that maybe I'll just kind of focus my attention on doing root canals all day. Okay. And that's basically what we're doing.
We're going to go ahead and get into that. We want to give you that phone number, 615-737-PLUS, 615-737-7587. We want to hear your question, but we're going to continue talking here. Let's break down, what does endodontics mean?
Basically what we do is we do root canals, or we redo root canals pretty much day in and day out. Occasionally you have a surgery or two that you have to do, and what we would call an apical surgery. But generally someone goes to the general dentist, they're in pain. It might be a case that's kind of a little bit more complicated for the general dentist, or they feel that we have tools that are a little bit more specific to the case, and so we'll go ahead and we consider them the quarterback of what they're doing, and they basically kind of send it off to us. We usually do the root canal, we send it back to them, and they do the crown. Oftentimes as well, some dentists do their own root canals. A lot of them did. I did my own when I was a general. But sometimes they don't work out well. Sometimes a root canal will fail, and then not many general dentists will retreat the root canal, so we'll go in there and we'll retreat it. And we do everything under a microscope. Things are a little bit different with what we're doing, but we pretty much do them day in and day out, and that's what we're doing, everything under a microscope.
Yeah, so it's a much deeper. So how do you, tell me about the difference, because I've never had a root canal, but you know, but you hear a lot of people get it. It's pretty routine.
It's very routine. A lot of root canals. Last week, I think Chuck Long or someone had called in and made a comment to me that endodontists are doing around 25 to 30 a week, and a general dentist is doing about 2 a week. And geez, I think I'm doing a handful more than 25 a week. But it's day in and day out. You know, there's always something that's kind of unique. Even though I've been doing it for 11 years, there's usually at least one case a month that I've never seen before still, you know, but you get used to kind of the tactile sensation of what you're feeling and things like that, and that's basically, you know, what we're doing in there, and just a little bit more specific with doing it with endodontics and doing it day in and day out.
Let's go to the phone lines right now. Thomas, you're on Open Line. Thanks for calling.
How you doing?
Good. How are you?
I'm good. Yeah, I was wanting to find out something. I'm a diabetic, and I take pills, but I'm having a lot of problems with my teeth as far as, like, during the night, I'll wake up in the morning and my mouth will be dry and I have blood in it. What I'm wondering is, would it be better for me to, I'm thinking about, because I've lost a lot of my teeth, but I'm thinking about having my teeth all pulled for dentures. Will that, by doing that, will that also help me with my blood sugars levels?
You know, I'm not confident that that'll help you with your blood sugar levels. You know, if you have something going on and you have bleeding going on with your gums, it sounds like you're having some type of periodontal disease going on there with that. You're going to want, of course, I'm going to say this with just about every patient that comes in, or every person that calls in, you know, you're going to want to check with your local dentist so that they can assess the situation and take x-rays and figure out what's in your best interest. If you are able to keep your teeth, it's always in your better interest to keep your teeth. As I explained one time before, you have what's called a master muscle, and it's the strongest muscle in your body, and you have about 300 pounds of force with that muscle. And when you remove your teeth, you have about 30 pounds of force. So if you go to the denture route, I used to tell my patients all the time, you know, you'll never enjoy a steak again. Your biting forces greatly diminish, your taste buds greatly diminish.
Oh, wow.
It is always in your best interest to keep as many teeth as you can. But if you get to the point where you have to lose them, then you have to lose them. If you do have to go that route, I'd recommend getting some type of implant retained denture. Not many patients like wearing the dentures anyway, and the lower dentures, they don't fit. They never fit, and they have a tendency to just fall out. So if you have implants retaining the denture, then you're more likely to be able to enjoy your meals a little bit more often. It's a little bit easier to chew with those in there.
Is that what do you hear that often with diabetics having issues with their teeth? Is there a correlation there, or is this an isolated incident?
There's a correlation there. There's inflammations and there's things like that. Whenever you have some type of just when you have something going on like that, there's always amounts of inflammation that's going to cause problems like that. Diabetic patients, I've never had a patient have any type of hypoglycemic attack or anything like that, but we always take our precautions. Whenever I have a diabetic patient come in, I always have my orange juice ready to go, just in case anything goes wrong and their blood sugars aren't right. So we take everything with a precaution, I guess, but there's definitely concerns there. There's definitely inflammation there when it comes to diabetic patients, yes.
And when he was asking if that option would help with his blood sugar, what was the correlation with that?
You know, I don't know. I don't believe that would help with your blood sugar. I can't for the life of me believe that, but having diabetes and having your teeth removed is going to be a better option for you. That's really kind of it in a nutshell, but I really don't know, to answer your question. I don't know how strongly associated the diabetes is with your health. You know, when I was a general dentist 5 years ago, you know, I knew that type of thing a lot better because I was more associated with it. I was dealing with it all the time. Now, as an endodontist, somebody comes in, if they have some type of systemic disorder or if anything is going wrong, well, if you need a root canal, you need a root canal. If this is going on or that's going on, if you need a root canal, you need a root canal. Regardless of what you have going on there, a root canal is going to make you comfortable and get you out of pain. So I don't know the diabetes and how well they're correlated as much as I used to, but there is a correlation there. I do know that. And your general dentist will probably be a little bit more qualified than I am to answer that question.
But generally speaking, I think that this speaks to, you know, what you hear about that, you know, people cannot avoid their oral health because it can affect their entire body. It can affect their overall health. Kind of talk about that a little bit.
It can, you know, it can affect their overall oral health. You know, you obviously if you're eating the right things and you're taking care of yourself nutritionally, you're going to have generally overall better health. It kind of snowballs as well. You know, people that generally don't eat well, don't take care of themselves well, they don't brush their teeth as well. You know, habits change, and people take care of themselves to certain degrees and to different degrees, and obviously if you take care of yourself and you are eating better, you're going to have less problems. That goes without saying.
Yeah. Well, Thomas, thank you for the call. We're going to talk to Pamela. Pamela, thanks for holding. Thanks for calling OpenLine.
Hi.
Hi.
My name is Pamela, and I was calling. I had a question.
Yes, go ahead. You're on OpenLine. You can go ahead and ask Dr. Horwat your question.
Yes, I had a root canal about 4 or 5 years ago. I'm 56 years old. Can you hear me?
Yeah, we can hear you.
Okay, and I wanted to know, I thought once he did the root canal that I would no longer have any problems with the tooth, and now when I went to the dentist, they said that I have a cavity and they need to remove it, and I need dentures because the tooth next to where they did the root canal isn't actually a tooth. It's one that, you know, it's some type of plastic or ceramic tooth, and so it would leave a big gap in the bottom of my mouth, and I'm just wondering, you know, is there anything that can be done since I had the root canal and now it's a cavity? I didn't know a root canal could turn into a cavity.
No, they can. You know, root canals can and do fail all the time. I reach root canals all the time. When you get a root canal done, depending on which tooth you've had done, you usually have to have a crown on the tooth after it's done, or you have to have some type of permanent restoration to protect the root canal. If you have a tooth is root canaled, you're more likely to have a cavity actually, because the tooth doesn't have all the reparative structures in there, the reparative cells, the reparative pulp. The pulpal tissue, when it finds an insult or injury to the tooth, the pulp will actually try to heal the tooth. When you get to the point where the pulp is a little bit too infected or there's a little bit too much inflammation, it's causing a patient discomfort, that's when we have to root canal of the tooth. But I forget the actual numbers, but I believe it's around 80% of the root canals, when they do fail, it's usually due to the restoration after the root canal, not the root canal itself. So you do have to make sure that they are restored properly. And then after you get a crowns on your teeth, or a crown on your tooth, or a permanent filling, you should be going to your checkups maybe twice a year. And that's when they're going to check the integrity of what you've had done. And they're going to make sure that everything is still intact, there's no leaking going on or anything like that. But it's not unusual to have something going on like that. Hopefully, if you were going to your cleanings twice a year, or even your checkups once a year, hopefully they were checking that out, and it wasn't something that kind of blindsided you with regard to that information. But with regard to the other tooth next to it, I can't really draw a clear picture of what you're telling me, and I can't really read the correlation between the two. I'd have to look at X-rays and kind of look at things to really give you a better answer for that. I really don't know, but you might want to check with your general dentist and find out what your options are. And it's never a bad idea to get a second opinion after you find out what your options are as well. I certainly wouldn't want you to go the denture route if you didn't have to go that route. A lot of people think that dentures are going to
be easier.
It's going to be easier. It's going to solve their problems. I know that when my mom, she has a full denture as well a while back, and back then it was in style. They thought that you get your teeth removed, you get a denture, everybody has pretty teeth. And then they didn't really factor in that your bone will actually kind of resorb over time. Whenever a denture does fit you, it won't fit you in about a year's time, because the bone's going to continue to resorb because it's not being utilized, and it's going to resorb over time. And so dentures is never really a favored option. Unfortunately, getting a denture is something that is a last resort when you really don't have many other options. Okay. So that's what you're going to want to do.
Fantastic. Great question so far. Let me give you that number, 615-737-PLUS, 615-737-7587. We're going to take more of your calls when we come back after this break.